is Jorge Chahla. I'm from Midwest Orthopedics Garage in Chicago, Illinois. Some of the benefits of a FastFix Flex device is that you can access most of a meniscus in the anterior, the mid-body, as well as in the posterior horn of a meniscus, mostly when you have an inferior leaflet tear like you will see in this case. You can also preserve the anatomy because the devices are 25% smaller than the previous version with an extremely reliable deployment. Our main indications for this procedure are persistent pain after failed non-surgical treatment with an acceptable meniscus tissue quality and wherever the inferior leaflet has a volume of over 20 or 30% of the meniscus. And here's our technique on how to repair a posterior horn inferior leaflet tear of a medial meniscus. You can see at probing that this is a very degenerative tear in a relatively young individual. There's a 38-year-old that has a radial component that only involves the white zone, as well as a horizontal cleavage tear of the inferior leaflet of the medial meniscus. A series of baskets and shavers are utilized to debride the white zone of the meniscus in order to identify the horizontal cleavage tear involving the red-white zone as well as the red-red zone. A shaver can be utilized now at this point to debride the portions of a meniscus that are unstable, with care not to remove too much meniscus tissue to be able to repair this tissue. At probing, it can be observed that there's a large horizontal cleavage component that is degenerative in nature that has a large superior leaf and a smaller inferior leaf. A rasp is utilized to aid in better biological healing. In this case, a reverse FastFix Flex device was utilized and bent in order to have optimal access to the inferior leaflet of meniscus. This is placed into the joint, and the curvature as well as the bevel of the FastFix Flex reverse will allow us to get very easy access to the inferior leaflet of the superior portion of the meniscus as well as to the capsule on the bottom. This will create a vertical mattress suture that will reduce that vertical leaflet back to the capsule, reducing the meniscus anatomically. Of note, this FastFix Flex device creates a very small needle insertion area, which is 25% smaller than its predecessor, as well as being 20% stronger, therefore improving the mechanics of the repair significantly. The suture cutter can also be used as a knot pusher in order to reduce the meniscus fully before cutting the suture. Additional sutures can be implanted in order to reduce the meniscus fully, both posteriorly and anteriorly to the previously placed one. It is important to place multiple sutures to ensure that we will have a strong construct. Just like we've learned with fractures, we need to place multiple points of fixation to ensure that the meniscus will be able to stand the load of a body. Sutures are then cut and the meniscus is reassessed with the use of a probe. It is important to close the mouth that can produce a parameniscal cyst in order to avoid symptomatic tears of a meniscus. At this point, a notch microfracture or PRP augmentation can be performed in order to aid in better healing of a meniscus. For the rehabilitation, we keep patients partial weight bearing for 2 weeks, with range of motion as tolerated starting on day 1. We like to work with this periodization concept of range of motion and edema control, advancing to strengthening exercises, agility, and endurance exercises at the end. These are important references to consider. Thank you.